Welcome to a review of the HealthyCircles Team Connect Care Transition application that ensures safer transitions from hospitals to home. Let's meet Jonas Morgan. Mr. Morgan is a gentleman who suffers from multiple chronic conditions and was recently admitted to the hospital for decompensated heart failure. You can understand why when you see the conditions that Mr. Morgan suffers from, and in addition, in reviewing his very significant complex medication regimen. During his hospitalization, Mr. Morgan was enrolled in the Care Transition application, and his record was completed, including updating information via CCD into the health record from the hospital's EMR. Let's meet his care team. There are a number of individuals that will ensure that Jonas is not readmitted to the hospital and goes home safely. This includes his son, Luther, his visiting nurse, John Tipp, his primary care doctor, Dr. Weber, and his cardiologist, Dr. Singh. The application enables West Allis Hospital to build a personal HIE around Mr. Morgan. All of these individuals opt into sharing the record, and granular permission setting can be set, which is in compliance with the new high-tech recommendations for privacy. Prior to discharge, Jonas completes the CMS discharge checklist, a copy of which is then deposited into his record and shared across his care team. This record has been completed by Jonas, and his son has accessed the family caregiver portion of the discharge checklist on his mobile device. You will see here that Jonas, much of this information has been pulled into the record, and he has the opportunity to answer questions regarding stating, as in question 5, that he needs help staying independent. The discharge checklist also auto-populates his medication list and allows the staff, his family, and Jonas to coordinate on medication reconciliation. The responses to the discharge checklist are automatically channeled into his message box, and Jonas receives follow-up information and links based on his responses. So, for instance, Jonas admits he's having trouble staying independent and has concerns about this. He is provided with information to the Aging and Disability Resource Center, area agencies on aging, and to the Medicare.gov site, as well as information directly back to his providers. In addition, that information is shared with other members of his care team. Dr. Weber was notified via text message that Jonas was concerned about his own ability to participate in improving his care. In response, she was able to use the Secure Messaging Center, and in the future we'll be able to use the direct protocol, to message Jonas and let him know that it's important for him to follow up with community resources, and she reminds him of his appointment in 2 days. Dr. Weber's staff also has the ability to set an appointment and alert for Jonas the day before so that he can reach out and arrange for transportation. Dr. Weber can access the application through her own portal, reviewing results of his surveys, messaging members of the care team about his various conditions, and complying with PQRI solutions and PQRI submissions, and sharing his record with other members of the care team as necessary. In addition, she will receive messages related to his needs and can monitor him using the triage dashboard. The system also provides clinical decision support to her in order to help her comply with evidence-based guidelines that are the basis of the care she's providing. We hope you've enjoyed this introduction to the Team Connect, ensuring safe transitions from hospital to home technology, and we look forward to sharing it with you on a broader basis and providing additional information throughout this process. Thank you.